Why do you think more like ethnic minorities did worse when they got COVID? Because I think a lot of the media's narrative was that it was just as simple as that like people of color just dealt with it, like had it, like their bodies dealt with
Yeah,
it worse. But I think there's so many other factors. Surely, I think
yeah, yeah. There's
economic
huge
is
amounts
one.
of factors. Yeah, yeah, yeah. So the socioeconomic like aspect of health is really really interesting because people always say like, oh, there's some ethnic backgrounds will have are like more leaning towards having this particular health outcome where it's like, oh, these people might have worse heart failure or things like that, or they might have worse like individual things that are that people say it's a medical thing, but actually a lot of the time it's actually from diet, or it's from like their living conditions, or more people might be getting asthma because they live in damp houses. They might have like more people who are having heart failure because their diet is horrendous and they're eating like really fatty foods or something like that. But that's because this is the way that the only thing that they can afford or whatever. There's much more like the way that you're brought up has much more of an impact on your health than your like how you're born, if you know what I mean.
Yeah,
Everyone's born with like a rough like equal chance to sort of have good health outcomes, but the way you then are that you live and you're brought up and you have to survive is a huge impact. And I think part of that is again like more people could probably be said to be getting it in ethnic minority groups because they are then much more often in a lower socioeconomic sort of state where they are living in closer proximity to each other. They have more people living in smaller houses. They have like there's much easier transmission, which is then more people are going to get it and be worse affected by it. So I think there's definitely a huge aspect of it which comes through that, which I don't think I've ever really seen people talk about much at all. They're doing a really interesting project. I think the bias in medicine around ethnic minorities and religious minorities is becoming much more of a spoken about thing. And they're doing a really interesting project at the hospital that I work at, where they've isolated the idea that there's an issue in medicine around what we see as like a normal body. So we might have something in a textbook that says this is a rash that we might see with a specific type of disease, and this is what this rash looks at. And every single time that rash is pictured on a white person. And they never really show actually on a rash on like darker skin or sort of slightly different colored skin will look slightly different. So they've started this really interesting project where I work, where they are now identifying patients that are coming in with these rashes or spots or like these different sorts of things, bruising, things like that, where we're used to seeing it on a white skin, and actually getting pictures of them with consent, obviously, but getting pictures of them and making sure that they are also published alongside pictures on white skin, so that doctors can come out and go, actually, I've seen this rash on this skin color, and maybe it is more dangerous, or maybe it's actually not as dangerous as it is. That gives them more confidence to say, this is what I'm looking at, and I know what I'm looking at because I've seen it before. So there's things like that which I think are becoming much more prevalent, and people are talking about much more, which is a good thing. Like people need to understand that.
I'm surprised it took that long. Like that's only just happening now. That's crazy.
It's wild,
especially in something like so scientific as the medical community. As objective as that. It's like it shouldn't be anything about race or anything like that. But yeah,
well, it's because people have for the longest time have gone, this is what a human body looks like. This is it, and never really thought about actually no one's body looks like that. No one's like that is just a fantasy, and everyone's body looks slightly different, even from white person to white person. things look different on one person to another. So like the recognition of like individuality and individual like health changes is wild, and it's much more being looked into, which I think is excellent, obviously.